Welcome back. I've got Mark Newman on the line. Mark, how are you today?
Thanks for having me. So it's another day in paradise.
I love it. I love it. So, why don't you share a little bit about you and the really important work you're doing in the healthcare space?
Yeah, so my background is really simple. I think I'm just completely unemployable. In college, I started my first company called HireView. It's all in the employer tech space. Spent 15 years building that organization. Been building Nomi for the last six. So co-founder, CEO of Nomi Health. Nomi Health and everything we do around healthcare is around how do we rebuild healthcare in America to cost 30-50% less because the system is totally unsustainable and totally unaffordable and nearly inaccessible. And so we work with self-insured employers and who partner together with providers to do something different. And we're having a lot of fun doing it.
Yeah, it's critically important. And we know that our population is getting older. And and just like everybody else does, the senior citizens are a humongous user of the healthcare space. And as we all get older, uh, we're going to be using it more and more. And the system is not sustainable now. Let's double or quadruple the demand in the next decade or two. How's that look?
For for,
It's
for sure. I'd heard this stat the other day that every I can't remember if it was every taxpayer, every American, one of the two, pays $1,600 a year toward Medicare, senior health care. Like, think about that. It's like we each are paying $125 a month, and that's just today. And it's just as hard for working age families, right? Like that's how I came into this business, where um, I was at the birth of my son. A lovely person came in, said, "Congratulations on your new baby." Said, "Thanks for having, thank you." Like, who are you? She's like, "I'm from finance. I'm here to talk to you about your bill." And it's like, and I know that feeling for so many people. Fortunately, I was in a position that I could take care of my bill, and by paying at the point of sale, like when she came in and did that, I got 30% off. And that was the entire idea for Nomi of like, it turns out if we can solve a business problem and simplify healthcare, we can get cheaper healthcare. Like providers love it, employers love it, families love it. Like, let's go do it. And yeah, we're tackling it because yeah, $1,600 a person for every Medicare member in America, let alone like dealing with our own healthcare costs and issues. Like, we got to do something.
Yeah, it's a huge challenge. And I think back to my three kids, and they are all in their 20s now, but every one of them, the bill 2x'd from the last one. So after the third one, it was like, no mas, no mas. It's like if I'm gonna be spending that kind of money, I'm expecting a steering wheel to come with it. It was getting,
I'm already paying for your college.
yeah, exactly. It's like, wait a minute, I don't really, how's class? It's like the baby's like 3 days old. It's like, so how's school? Your professor good? They're like, they're just trying to figure out what's with all the lights.
Sure.
But yeah, I think back to because I used to work in healthcare, primary care as an executive of clinics and whatnot, and I remember talking with a physician years ago, and he was originally based. He spent probably 15 years just outside of Indianapolis, and he was part of a
Mhm.
huge, huge system. And he said, the best month he ever had in the 15 years was he was able to collect about 62% of what he built.
What?
And yeah,
Wow. Okay.
yeah, yeah, and
And those bills are like the contracted rates that they should get. Like
yeah,
that's the funny thing that we think it's some absurd high price. No, that was what they were theoretically contractually obligated to get.
yeah. Yeah, and he, the organization, that we had, he said the entire floor is the billing department. And I'm thinking, from a business efficiency standpoint, it's like, okay, and nothing wrong. You're creating jobs for people. That's awesome. That's a good
Mhm.
thing. But it's like when you have an entire team of people just to invoice the service that you provided. And then and of course, the myriad of providers and insurance. And if you don't code this right, then they'll deny it. And, it's okay. It's the barometric pressure on Thursday is this. So we're going to pay that. I'm kind of stereotyping and cheek, but I'm not really.
No, it's totally like that. The variance that we see in price points for the same service, you're like, okay, like Tom, Bill, and Sally all just typed in different numbers. Like there is no consistency on this entire part of it. Yeah, we it's like think of restaurants or any other service in America had to function that way, where there's a department whose entire focus is just figure out how to get paid.
Yeah. Yeah. And it's frustrating and it's challenging and people are disgruntled by it. And then, they go and we know this and this too. And there's a lot of people that will avoid getting health care because they don't want to get the bill.
Yeah.
And these are people in many cases where they really need to get checked out because it could be something that could spiral into something catastrophic for them, or, shorten their life if they don't get it something addressed sooner than later. And, so many people just avoid it. And, that's why, the model that you are working with, and, and I love the fact that you've partnered with, the providers, the individuals, the users of the system, and everybody involved, I think makes such a huge difference because you can control what the costs are going to be. The providers are, correct me if I'm wrong, they know what they're going to get. So they're not going to have to go, well, am I going to get 60 cents out of a dollar on this?
Right.
Oh, they know what they're going to get. And it saves them a ton of the overhead costs. They don't have to have a billing department for it. They can scale that back quite a bit so they can, spend that money on, I don't know, more exam rooms, or, bringing on additional clinicians. There's so many things.
Think about how much time your doctors that when you were in primary care, think about how much time your doctors had to spend on administrative tasks every week, justifying their existence and justifying their ability to get paid for the work they did.
Yep.
Like if we simplify how easy it is for a doctor to get paid, it turns out we'll have 30 to 40% more capacity for them to see more patients. So then we solve access. We don't need to have 20% more primary care doctors if every primary care doctor gets 30% more time, right? Kind of on this part of it, because we won't fix that with more medical schools, right? We need to fix it with like the business of healthcare. And and our whole model is very simple. That doctor that you referenced getting 62% on its best month. We're like, tell you what, the irony of all of this is that you get 62. The insurance company says it's $1 because of rates and patient collections and all these kind of different things. So an employer is actually paying about $1.20, right? Because they have to rent the network, rent the services, rent the fees, rent the payments, rent the this, rent the that, and they come up with their plan design. But like if Michael goes to the doctor and doesn't pay, the employer doesn't save money on healthcare, right? But the next time around, their overall cost of healthcare has to get priced in with the risk of non-payment, right? Kind of on this. And so if we just say, hey, doc, guess what? How about just 75 cents now? Right? Like, because ultimately, we're not negotiating, like the employer doesn't pay 63 cents. The employer pays $1.20 or $1, right? Like, and then it just goes into the nether. On this. So how do we pay you 75 cents right now? And now we bring it transparently back to the employer at 80 or 84, right? Based on service level, and run healthcare that way. And it turns out employers save money, families save money, providers make more money. And that model for the member is no copays, no deductibles. So they get the care that they need. And it's hard. People don't believe it can happen. People don't think it can change or whatever it is. So maybe we feel like the Rebel Alliance in Star Wars, but like, let's go do it.
Yeah. Yeah. The ones that, say, well, it can't be done are the ones that do it. And that's what, Nomi is doing. And, thinking back to just being able to see additional patients. And, I spoke at a Becker's Healthcare conference a few years ago on this, and it was a topic of physician burnout, which is a huge problem. And physicians aren't burned out from seeing patients. Okay.
Badly. Yeah.
It's all of the additional compliance and reporting issues that were thrown onto them over the last 2 decades. And I'm not going to debate the Affordable Health Care Act one way or the other, but a component of that was there was just a skyrocketing amount of reporting and compliance that physicians are tasked with. They spend literally more time doing the administrative side of things than the actual let's talk with the patient and diagnose what's going on. And we see it. And even with charting, now there've been a lot of inroads over the last couple decades with charting, with, voice recording and translation. And now, with AI technology, there's options there to help streamline that and be a co-partner with physicians on things. But when it comes to, the billing and the reporting and all of that, it's so taxing. And quite frankly, and I'm not picking on doctors at all, but people are wired a certain way. Clinicians and doctors, science, diagnosis, they can see things, they understand how many milligrams of whatever to prescribe and how to address it, and understand, okay, this won't work because you're on this medication, so we're gonna have to do this. They're very intelligent when it comes to that kind of thing. uh, Filling out the paperwork and documentation and things like that, and for many of them, is a big challenge. And I'm not diminishing them at all. It's just they're not wired to do that
They
stuff.
should,
So, and they
exactly. We wouldn't,
shouldn't. Yeah.
right? We want everyone to be able to do their best work. Does it make sense? Like we always talk like like work at the top of your license, right? On this dynamic, and um, we all go into healthcare and we all think of U.S. healthcare as like that moment in time when somebody we love has either the thing understood, figured out, or solved, right, by that person that we trust, and it's like this magical experience. There's two chunks though. There's the delivery of healthcare, which is more likely that moment, and there's the business of healthcare, which is unfortunately the chassis it has to run on, right? Kind of on here. And when that chassis is broken and those wheels are falling off and that gear drive isn't working and the transmission is clunky, right? And the engine is like in that, out of sync and intertwined. Like, do we think it affects the delivery of healthcare? Absolutely. Right. And so we try to, and doctors are naturally the types that seek more education. I have a brother-in-law that was like, I'm going to go figure out this business of healthcare thing. I said, yeah. He's like, I'm getting an MBA. And I'm like, oh, that's not going to help you much. It might help you understand the pain more. But then unfortunately it was like we got to go and do this. And yeah, it's like how do you just break apart this delivery of healthcare and business of healthcare, and we just focus in on fixing this business of healthcare so it enhances the delivery of healthcare. And like you're seeing some interesting green shoots, like, well, you're seeing the fed upness of like I'm out, right? And then you're seeing other people that are saying, I'm going to free myself and go to my own system. I'm going to do concierge. I'm going to do telehealth. I'm going to do direct primary care, right? I'm going to do these things. And they're almost like symptoms of the broader problem, right? Like they're desiring to be cash pay healthcare. They're desiring to be direct. They don't want to bill anything. And it's like, yeah, and it works. And they're happier and members are happier and people are more taken care of and it costs less. So like, why don't we go do that?
Yeah, their net income is quite frankly higher because they don't have all the administrative costs and the chasing and, okay, when are we going to get billed and when are they going to pay, and all of that, and everybody again benefits from it. And again, and I'll go out on a limb here, it improves healthcare outcomes because
Totally.
the doctors can and clinicians can focus on the delivery of healthcare and not the business side of things, because the business side's taken care of. It's like, I know I'm going to get the $75 for this procedure. I don't have to think about that. I can go in and see what's happening with Mrs. Smith, or Mr. Jones, and what do we need to do? Okay, how do we work on this? Okay, what's coming up? Anything different? And I don't know, here's something weird. They can actually spend more than 12 minutes with them because they don't have to be on the rat race of, seeing a bunch of patients quickly so they can somehow generate enough revenue for them to be a viable entity. Because again, they have to think, okay, I need to see 35 patients a day for me to be able to cover my cost and with the staff and this and this. And of course, we know that a lot of physicians pay student loans for
For sure.
centuries. So there's that weight. A lot of younger physicians that I worked with, I knew, I didn't know what the amounts were, but I had a pretty good idea of what they were looking at, and I'm thinking, you're going to be paying that for millennia, and I say that tongue in cheek, but it probably felt that way for them. So you know what? That's constantly in the back of their mind.
Yeah,
And instead of going, okay, here's a model where I know I'm going to get this based on this and don't have to spend so much time on the administrative side, like you said, which will allow me to see more patients, which then means that will help me address that debt a little bit on a quicker pace than if I would be under the quote unquote traditional system that so many people are in right now. So that's why it's so important for people to look at this, because I'm for one thinking, how do you, people ask me, well, how do you fix healthcare? And I'm like, okay, one, you got to simplify it, which that's what you've done. You've done that. You've cut out a lot, and I know it's a humongous business, and I know there are the big players that do not want anything to change because things are really good for them. And and again, I'm not naming names, but people can take the puzzle pieces, and there's only like 3 or 4 pieces, so you should be able to fix the puzzle pretty quick. You're gonna get it. It's age 0 to 2. There's like little eight, floor
It's
days.
like the Happy Meal puzzle. Frick this, those pieces, and
Exactly. Find the corners, boom, 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 and you're done. And you go, oh, it's them. Yes, it's them. And again, they're in the business, and but it's not working for majority of people. It will get much, much worse, and there are other opportunities for those organizations to do things to benefit themselves and all of that. It's not a thing where we need to put people out of business to do this, but we got to approach this differently. And
if you just took the math, right, and you said, okay, how do we fix this? Well, what if we doubled the pay of it's like doubled the pay of every teacher in America? What if we doubled the pay of every primary care doctor in America? Right. And we said, okay, well, like meaning you saw more patients, you had more time, you had less headache, right? Like whatever we kind of think about this, and your job is preventative healthcare. Okay. Well, if the average pay is there's 280,000 primary care physicians, there's another 200,000 nurse practitioners, et cetera, called 500,000 people. And between them, their average income is about $200,000 a year. Okay. So you're talking, $60 billion, $70 billion, something like that. That is 1% of healthcare spend in America, 1.5%. So if we took that to 2.5%, right, they're kind of on there and said, all right, do we think if we doubled primary care and said your job is for preventative care for everybody, and people don't have to pay to go to primary care now, or something like that, right? And you go and get this, and between that and generic drugs and all this kind of various kind of core treatment pathways, we addressed that, and we doubled their income. Would we save 10x? Again, and I would bet if we said, all right, we're going to double your income, your job is to, and everyone can get free primary care. Because essentially the doctor's income is essentially the cost of primary care, right? There's a very tight correlation to it. And yes, there's some overhead. Yes, we can simplify the math here for the purpose of the discussion. Call it $100 billion all in. We double that to $200 billion on primary care, $150 billion. On $200 billion of primary care. Would that save $500 billion a year on healthcare costs? And I guarantee it would. They might even save $1 trillion. But and that's real money. Like what would we do in America if we cut healthcare costs 20% in America right now? That'd be $1 trillion back into the pockets of every business and family in America every year. And the government every year. 20%. Anyone can find 20% in any market in any organization, and that's how we think about this. It's like you could pave every road twice.
Yeah, and fix the infrastructure and reinvest in things and new technologies and new sciences and things like that, all with that. And again, making that switch, quite frankly, to entice physicians and majority of physicians I worked with, and would basically agree with me that if they were compensated properly for preventative care instead of reactionary care, they would make that switch immediately. They were like, yeah. And what does that do? Well, if you can prevent someone from getting diabetes or hypertension or high cholesterol or heart conditions or anything like that, if you can head that off, you're right there. You are saving hundreds of thousands, if not millions of dollars per patient on that. But that's not how the system is currently wired. It's like, no, it's reactionary completely. Yes, you have, some preventative things in play, but you tend to see that in a variety of different roles. And again, the physicians are doing what they think that they have to do in order for me to build the insurance company, I have to go with this because I get paid for this and I'm not getting paid for that. And, you can get really,
it's all games. It is all rational behavior in a wildly irrational market. Does that make sense? Like, and if the market was actually rational, then you'd actually have more rational behavior, in these parts of it. But it's a wildly irrational market like that. A diabetes patient you talk about, that's a $20,000 a year patient. To cost of health plan probably can be 60,000 and can be 10, but like, averages out to about $20,000 a year. And that $20,000 a year, it's like it turns out if they're making less than 50 or $80,000 a year, $1,000 a year of fresh raw groceries delivered to their house, like vegetables and this would be a transformational change in that diabetic's life, right? And it turns out if we really focused in on the cost of insulin and really focused in on this and really focused in on that, transformational change, in that person's life. But like you said, like we just wait till it happens. And there's a lot of really good intentioned people that all trying to do something about it. We'd like to put ourselves in that box. So you're seeing it, every administration change, every administration has good ideas and they want to go and execute them, right? And everyone kind of like goes down this path. And, 20 years ago, people were complaining about healthcare costs. 40 years ago, people were complaining about healthcare costs. Um, we are at the bottom of an infinite growing cost curve, and it's scary. Like it's scary for a family that's starting out. They have housing, they have healthcare, they have this, they have that, right? Like I get it, which is there's a change. There is a change, and it's like if there's like-minded people that want to come be part of the change, like figure out how like-minded people work together.
And save the system and save ourselves as well. It'll make such a huge difference. And having attended way more healthcare conferences than I wish I did, and I've done it for, because I was in the sector for almost 2 decades. I think
Yeah.
back to the presentations that I saw when I first entered, and I think back to the presentations that I saw, at the end of my healthcare experience. And other than changing a couple pictures, they could easily rolled out the same slide deck.
No, they did change. The cost was down here, and now it's up here. But,
And, and,
no, but
and the age of the population was here, and now it's here. Yeah.
yeah, they changed. They just got updated. Rolled forward. Yeah, and that's where like we said, there's some things that we just have to admit aren't working. Hey, value-based care not working, right? Having doctors flee the sector because they have to spend all their time documenting paperwork, and they'll do literally anything than do that. Okay, that means something's not working, right? Hey, getting prior authorizations that don't create the notion of a contract to get paid for the service you delivered. So then why do we have them? Or why don't you pay? Okay, not working, right? You know, how the journey of a dollar from like what an employer pays to what a provider or a pharmacy or a drug manufacturer even gets goes through so many labyrinthine steps, not working. And in every other market, what we've noticed is that um, people, innovators, entrepreneurs, founders, whatever you want to call it, change agents, whatever, say, let's make it simpler to like book an airline flight. Let's make it simpler to pay this bill. Let's make it simpler to split a check. Let's make it simpler to go to this event, right? Like we all grew up remembering standing in line for concert tickets. Now that's absurd, right? We would never do it. I don't even know if you can stand in line for concert tickets anymore. But like you said, those 20 years of presentations, people go, oh, it's healthcare. It's really hard. It's really unique. It's totally different. And it's like, well, no, in my personal life, I book a flight to Miami. It comes up with a rental car, hotel, show tickets, weather. It can tell me absolutely everything. It give me ideas. I can like have it tied into my credit card. If my credit card gets used in the wrong place at the right time, they'll call me in 60 seconds and say, Mark, this isn't you. Let's change your card number, update it all for every one of your digital subscriptions, and get you a new card at your house in the morning. And you're like, wow. But for some reason in healthcare, we think we should still use traveler's checks, and that's the most efficient thing to do. And we just got to get with the program. We got to catch healthcare. We don't even have to totally innovate in healthcare. We just got to catch healthcare up to the real life of everything else, in there and do it and do not take any other answer as acceptable.
And I remember skipping second hour so I could get Bon Jovi tickets and standing in that line at the bottom of Hudson's in Waterford, Michigan, to date myself.
Awesome.
So
But yeah, awesome. And we just got to be fed up, and we can't stop, and just go. It's we just got to do it.
absolutely. So, Mark, where can people find out more about you, Nomi, and this amazing work you're doing?
Any provider, any employer that is just fed up with how their healthcare works, come join us at nomihealth.com, NOMI health.com. I'm Mark at nomihealth.com if you want to reach out direct, but come to our website, come join up with us, come join our network, come join our, come join the Rebel Alliance around the people doing something about healthcare costs, and let's go do it.
There you go. I'll definitely have that in the show notes. So, Mark, thank you for your time. Thank you for doing this very important work. It's desperately needed for health and humanity. So I really appreciate your time on the show today.
Thanks. Have a great day.